What causes heel pain in children? It's not plantar fasciitis. It's something called Sever disease, and that's what we're going to go over in this episode. A lot of children come into the office and they have this condition called Sever disease. It's named after a person named probably Dr. Sever, but the technical term is Calcaneal Apophysitis. So let me explain this. The calcaneus is actually the heel bone right here, and the apophysis, this represents the growth plate, and itis just means inflammation. And today I want to go over exactly what this is. Before someone comes in, if you're a patient of mine, I'm going to ask you how long you've had the symptoms, what treatments have you tried, how does this impact your life, and that's what we're going to go over. I want to explain a little bit more about this. I had a patient recently that came into the office. It was a little girl. She was 6 years old, and she has had this for a number of years. Now, this is not common to have it for a number of years for such a young age. But in her case, she had something that's different. I'm going to go over a little bit more of that. It's called equinus, which is basically a really tight calf ever since she was very young. And also she did ballet and a lot of other activities that caused increased tension in the calf. So one of the keys is to treat that calf. And I'm going to talk about that a little bit later. Okay. But the gist of it is that Sever disease is pulling on the growth plate. This area here, where that growth plate is right where the Achilles tendon inserts. And if you can imagine, if you pull on that Achilles tendon, it's going to pull on the growth plate, and that's going to cause pain for patients. Not everyone, not all kids have pain in this growth plate, but there are certain conditions that they have it. Let me just explain a little bit more. Just to simplify it, it's painful inflammation of the heel growth plate. Now, there are certain age ranges for your children. So for boys, between 10 and 15, and for girls between 8 and 13. The main reason is because girls, they mature quicker than boys. And what you'll see here, some typical areas like playing soccer and things like that, just another example of the Achilles tendon where it inserts into that growth plate. Now, can children have it earlier than this? I said I saw a girl that was 6 years old and she had it. You can have it earlier, and the main reason is because of equinus, or a really tight calf, that can aggravate things. Let me show you this. This is the way I explain things to patients in the office. It's called a dysfunction symptom index. Basically, what I like to say is that we all can develop symptoms sometimes in our life, and as your age, you can see here on the bottom, as you get older, you could develop more symptoms. Now, a lot of people, they don't have any symptoms in their heel. But a lot of other patients, they can develop plantar fasciitis, or children even, they can develop something like this Sever disease. What can cause it? Well, anything that causes dysfunction. So the most common things for kids are shoes, maybe like a soccer cleat and they're jumping around, a certain type of impact, like they're jumping, running, things like that. They could have a high arch or a low arch. That's a deformity. And they could also have tightness in the calf. And then I find those that are either they're not doing as much movement or doing a lot of movement, like these kids that are doing tons of sports, tons of jumping, that can cause them to go into this dysfunction area or this symptomatic area. A lot of my patients, they come in and they have symptoms, and then I can do treatments and get them out of symptoms, but they may have recurrence of it until that growth plate heals. Now, just so you know, all Severs kind of goes away over time. So it's caused by jumping sports, overuse, shoes and cleats, tight Achilles, or that equinus thing, which just means a really tight calf muscle, or growing spurts. Once again, if they're growing, what happens is the foot grows, the bones grow, and the tendons pull harder and they have to catch up. So what are the symptoms that you're going to feel if you have Sever disease? Basically, you're going to squeeze the heel and you have pain to the back or the bottom of the heel. When you squeeze the heel, if it hurts, that's a big sign. If you're limping, if you want to walk more on the ball of the foot, that could be an indication of Severs. If you're walking on your toes, if you have difficulty when you're jumping or running, if you have pain when you squeeze the sides of the heels, that's the telltale sign. So you take the heel and you squeeze it, and if that hurts, that's a problem. And for a lot of my patients, it actually happens on both sides of the heel, but some people only have it on one. So how do you diagnose it? The best way is with an exam with a doctor. You can try to diagnose it on your own. You can try some of the treatments here I'm talking about. But if it doesn't get better in a couple of weeks, you'd probably see a specialist, either a podiatrist or a pediatric orthopedist. That's a better way than going to see someone in urgent care. An x-ray will help because you can see the open growth growth plate. Not very common to have a fracture. Many people think that this might be a fracture. This usually is not a fracture. Occasionally an ultrasound or an MRI is needed, very rarely though. How do you treat it? That's what everyone wants to know. You reduce your activity and impact. Now that's not possible for little kids, right? So you can use a support or a cushion to the heel, an oral medication like Tylenol, if your doctor allows you, a topical cream. There's different topical freezing creams or icing creams. But the most important thing, I think, is reducing the tightness with physical therapy, foam rolling, and other types of treatments we're going to go over. So reducing inflammation, I don't give a lot of kids anti-inflammatories. If you're in a game, very active, you might want to use it for a short period of time, but I don't like to do it long term. Icing, I find is helpful. So icing with a water bottle, putting it in an ice bath, those are all things that can be helpful temporarily, but you really have to work on the loosening. The calf muscle that's very, very tight is the Achilles tendon and all the other muscles that come down in the back of the leg. That's going to be a big focus. There are a lot of different tools that you can use. There's massage guns, there's little rolling pins, there's this type of thing, there's this type of thing. And if you have a child, you're probably going to have to do it on your child on the back of the calf. Okay, 10 minutes twice a day is what I usually recommend. Now, something that you might find beneficial is called a compression sleeve. So all of these things, I'm going to put a little link underneath to an Amazon store that has kind of all these things. If you want to try these, you might be able to avoid one visit before you go to the doctor. Basically, when you come and see the doctor, if you've done this stuff, they'll send you right to physical therapy, or that's what I would do. There is also different types of inserts you can try. This is something cool. It's a little heel cup and a compression sleeve together. So kind of a combination cup for cushion and a little compression sleeve. Orthotics can be helpful sometimes. Not everyone needs orthotics, but if you have a very flat foot, an orthotic can be helpful. And then this is an example of the physical therapy modality that's done called the Graston technique on some of the children. So I find that physical therapy can be helpful. Now, this is just something, I don't normally do this, but occasionally if you're having a painful area, you can do shockwave on it. Once again, this is not the first line. This is kind of an advanced thing. So let me conclude here, kind of going over how you would treat this. Initially, you would get an x-ray. Very rarely do I get an ultrasound or an MRI. I would start with reducing tightness. This is number one. Start with a towel stretch before you get out of bed or before you do activity. Home therapy, which is some type of a foam rolling. Then physical therapy. I don't really give these to kids, but you could try a night splint. That's something you could try. That's something that holds your foot up. You can try a compression sleeve like I talked about, a supportive shoe, a heel cup, that heel cushion thing we talked about, an orthotic. And if it's really bad, you can do one of those walking boots. Anti-inflammatories, icing, pain creams. Once again, only if nothing's not getting better, a shockwave and a second opinion. So I hope you guys found this beneficial. I'm going to give some other resources here afterwards. And there's a link, once again, if you want to try this stuff on Amazon. Hope this was helpful. Please put your post. Let me know what you thought. Let me know if you have this, if you have any things that have worked for you. Okay? Thank you. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.